talking about it. I'm guilty of saying at some point in my life that, well, you're just going to go talk. I mean, you can talk to anybody.
Yeah.
And I learned through my own journey sitting in front of my therapist like 4 or 5 years ago is he was listening.
Exactly.
He was actively listening, and he was actually writing down notes. I thought he was drawing the entire time, but he was actually writing down notes. And after seeing him for 3.5, 4 months, it's at that point he was able to reflect on everything that I had said and, you know, look at me and just say a few things. And one of the stories was he had gone back pretty far back into my childhood, and you just actually said it as well. He went beyond that. He went to before I was born, like to the womb. That's his kind of theory. And with a very few words, he was just, he kind of looked at me and says, I want you to know you're not the victim anymore. And just to be able to say that 4 months later, and just to kind of stare at me and say that's what happens through talk therapy. We're talking through it. And I'm also guilty of saying, well, I'd rather someone go to hypnotherapy. You can go do your motivational books. You can do the chakra chanting. You can wait till Monday when Mercury's in line with the moon. And I finally came to the conclusion I understand, and I recommend talk therapy to so many of my friends is because there is a process that's actually happening. It's not just you're just sitting there and I'm just talking and that's it. It's almost I'm peeling away layers as I'm going through.
Yes. Well, first of all, it's not a social conversation.
Right.
In a social conversation, you're trying to make the other one understand what your message is. And so the other one understands your message and you get a response from the other one. What is it that you think of my message? Or are you getting my message? Am I allowing you? So it's not a social conversation. Here, you're listening to yourself. You learn to listen to yourself. It comes back to you, and there's some movement in that. Because usually we're stiff. You know, people come with their issues because they're unflexible with something that they've been repeating all their life, and they don't know how to move from that. And so talking about it gives it a little bit of air, a movement, and allows things to shift to a different place. It's like you're putting yourself, you're a part of you takes a step back and looks at yourself and sees, oh, right, something.
I like how you just said that. Yeah. I think that's what he did. I was talking about the same thing over and over again using different words.
Right.
And as you mentioned it, there was the whatever the issue is, sometimes we have different ways of talking about that.
Mm-hmm.
But he allowed me to consistently keep talking about it, and it was layer after layer was kind of coming off till we were getting deeper and deeper to the point of that's it there.
And then, of course, the trained therapist has an ear, and depending on their school of thought, will approach that differently. And that's where you have to do your research and see what works for you, what you want, because that's part of finding the good fit is knowing what approach you want to therapy. And the only one who can decide that is the person who wants the therapy. So depending on that training, that ear will listen to things in one way or another. So it's not the same to be a CBT kind of therapist listening to someone than to be an existential therapist, because they'll listen to things from a different perspective and but they're going to be attentive and point out to things depending on their theory, and maybe saying, oh, you just said that. Depending on their theory, they'll say it because of something that they believe. And that is what makes that difference.
And so through us telling our story, is it almost as if we're not regurgitating? What's the word I'm looking to use? We're kind of emptying everything out in a sense. Are you kind of giving us a safe place to get it all out?
Well, that's the idea, that you can feel safe. Of course, it's very important to feel safe and have that rapport with the therapist, that you feel that that person there in front of you has something that will help you. It doesn't matter if it's true or not. If you believe that the other person has the know-how that will help you, that in medicine it's the same thing. You go to a doctor, and part of what is helping that individual is thinking, oh, this doctor knows what I have and will give me a solution to it.
Yeah, that's
it's very common that you have hypertension, and when you see the doctor, they measure it, and it's fine now because now you're in good hands, so your tension comes down. It works that way. It's kind of a placebo kind of effect that anything can have when you're in front of a professional that you believe in.
I think I brought this up with you before.